from your experience, what is the mistake they are making and how they can avoid making it?
It does not teach you how to manage finances and how to build your own setup and how to manage your own practice.
At the end of the day, obviously finances matter.
Finances are one thing. Other thing which is not being taught in residency is how to talk to a patient.
Sir, have you ever faced this challenge? Like patient comes from कि यार AI में तो ये बताया है, ChatGPT
So
ने.
daily basis. So one of the patient came with a condition called pengecola. It keeps on giving you prompts. Do you want me to do this? Do you want? He landed up with a diagnosis of cancer, eye cancer. So he came with a panic.
I do have a direction in my life, but I don't have clarity. Like where I will land. Sir, how can someone develop that clarity?
The clarity does not come.
It will never come.
But why do you want a clarity?
Have you ever faced this thing? Like when you are at a point in life when you are seeing two roads.
Multiple times in a day. So the idea is just take one step at a time, then go with it. As Mayank said, don't regret it. You have taken the decision. The path will choose yourself.
Sir, with AI in ophthalmology, sir, how it will change ophthalmic field?
Today's podcast, all the question answers I actually saw on AI.
Sir, even I prepared this podcast on AI.
चल इसी बात पे cheers हो जाए.
Sir, you all choose ophthalmology. This is one of my first questions in every podcast. Sir, why you guys choose ophthalmology as your career?
So I have a very interesting answer to this. So I was always interested in surgical branch. I always wanted to do something, you know. So I always thought, I'm sorry to all my medical colleagues, I always thought just writing medicines is not enough, you know, I should be able to do something to them. So I actually wanted surgery, general surgery. So because, you know, we were taught that, you know, this is how you do a surgery, you remove the appendix, you know, so maybe ortho, you know, you just join the fracture or something. First time I joined residency because I was not that good for a general surgery. I got ophthalmology at All India Institute, AIMS. And the first surgery I saw was vitreoretinal surgery. I saw a surgeon is looking into the retina and he had made two ports inside the eyeball and he's seeing the vitreous and the retina as a whole in such a big screen. I was so fascinated. I was like, wow, this is something I want to do. This is the precision, you know. The 1 centimeter here and there makes a hell lot of a difference. You are now counting in microns rather than centimeters or millimeters. So that was the first thing I said, yes, ophthalmology is for me. I want to do something for the patient, but at a very micro precision level. So ophthalmology it is.
Yeah, I think same here. I think we all would agree. All surgeons in MBBS days, we are taught that you have to choose your bent of mind. Either you have a medical bent or a surgical bent of mind. So I think all ophthalmologists have a surgical bent of mind. So the internship is the period when we get to experience all fields of medicine step by step. So that is when most of us make our choices. So again, when I went to the ophthalmology theater, so I saw the craftsmanship. So I saw basically it was a trauma case. It was a corneal tear. Somebody got hit by a bullhorn. So I saw the surgeon repairing the cornea step by step with a very fine suture. So that was the fascination moment for me. So that made me like, okay, this is the branch that I'm going to do now. So I think we'll all have such kind of stories sharing.
So what's your story?
My story started when I was born. And that was the end of the story. No, that's not true. But I guess if your parents are also, and your grandparents are also ophthalmologists, that does have a role in shaping who you are or who you will become, at least what was there in the past.
So I think they already chose the best for you.
Yes, that's true. So I think they made the decision easy for me to choose ophthalmology. And the specialty also was easy because I had to pick what was not there, what was not practiced.
So, sir, you all have like more than 10 years of experience in ophthalmology. Sir, what's the best story you can tell me about a case, about a patient case? What's the best case you have ever encountered in your practice?
So, one case I remember very vividly is after finishing my fellowship, fresh out of fellowship. When you're fresh out of the oven, you remember you are full of knowledge. You know, you finished everything. You're quite educated. But when initially in private practice, during the first 1 or 2 months of my practice, it was not even the case of my specialty. But I'd still remember it very well. Why? Because that patient had a history in which he lost one of his eyesight 1 week back, and then after 1 week he lost the other eyesight also. So when he came to me in the clinic, he just had no vision in both the eyes, and it was quite perplexing to understand why he lost the eye within a matter of a week. Nobody was able to understand. And I think just by taking in the history that time, because I had never seen that clinical scenario before, the patient actually had giant cell arteritis, which is a rare disease. And after that day, in my 10 years of whatever X number of years experience, I've never seen that case again. I only saw it once. Never before, never after. I read in the books. So the patient actually, when he came that day, something struck in my mind that he had actually one eye's vision was no light perception, and the other eye's vision also was no light perception that day when he came to me. And I was not understanding what it was, but somehow I asked him the history, and he was having pain, acute pain, while touching his scalp, and while combing the hair, and while opening the mouth. So I just put two and two together. That time somehow, if the patient comes now, I may not even diagnose it because that's not my field. But that time I was able to catch the diagnosis, and we sent him to the hospital. He did the biopsy of the artery, and it came out positive. And so his vision from light perception became 6/6 within 1 day after taking steroids. And if he had not taken steroid that day, not just his eyesight, he would lost his life. Because and so till date after still the patient comes, he just comes for a checkup. He's perfectly fine, but he still comes. He says, "Yeah, I'm still very happy you saved my life." Though ophthalmology is not a life-saving job, no, normally, but this patient had value.
It turns out
The
to
value.
be.
You're not even a retina patient, which I normally see. But this has happened. I never saw it before. Never saw it after. Just once.
Sir, ophthalmology is life-saving.
Yes.
So there are, I would
It is,
disagree.
I
I would
know.
disagree.
No, you're right.
Any disease in the body, eye has a
Yeah,
manifestation. You can just, look into the eye of your partner maybe and judge what problems they are going through. So,
That's
yes.
good. That requires to be a good spouse. If you can't catch that, then
A dilated
there's
one.
trouble. Yes. Chirag, any story that you would like to share?
Yeah, just sharing not from my field. I'm a cornea specialist, but we all do see general patients as well. So it's a happy moment. So it was a 2-year-old child actually. So he was having very troubled sort of milestone as we say, the delayed growth, those kind of thing. And we did a simple refraction, and he found out that the patient had a +4 diopters of glasses. Obviously, a 2-year-old child won't be able to tell it. But the moment we put the glasses on the child just stared at his mother for about a minute. And then he laughed. So it was actually, for the first time in his life, he has seen his mother so clearly. So it was a very joyful moment in the OPD. Everybody laughed. Everybody could understand what happened. And it was an amazing moment. So that moment I remember every time I see a child, and that's why I would talk to a patient now. So this is something that small kids, they don't know what clarity is. But once a simple refraction can do wonders to those kids.
सर इट इज नॉट लाइफ चेंजिंग फॉर देम बट फॉर द सर्जन एज वेल
Yes,
है ना,
absolutely.
वो बैठ जाती है बात
दिमाग
दिमाग
में।
It
में.
is. It is. So this awe moments, they're full of it. If I start actually, they would be, more than a day, because you deal with children, and you deal with such complexities that no one else would be able to understand or are willing to understand. So you have to deal. So there are many moments, but one moment that actually I still remember very vividly. So I was in residency, the final year of residency, and we had our exams coming up, and we were given this cases to work up, and so because we have to read for exams, so we would like quickly do it, or maybe run here and there. So I was running in the ward here and there. So not my bed, not my patient, but I was in a glaucoma ward, and there was a patient admitted for congenital glaucoma. So I saw the father who's blind with congenital glaucoma, both the eyes. He's not able to see. I saw the mother blind from congenital glaucoma, not able to see, with their child who's approximately maybe 2 to 3 year old, admitted for congenital glaucoma, and they were playing very, 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 very happily. So I was like, wait a moment, why are they happy? They are blind. How can they see their child? And they both are sitting at two ends of the bed, securing the boundaries so that the child does not fall. And they're playing with him. So, there is something beyond the vision also we should see. So that was like, vision is not the end point. There is something beyond it. So that actually, I would say actually, inspired me to give these young ones the vision of their life so that they don't have to, face such moments later, maybe, in the bad way. But that is something which actually, stuck with me. एक्चुअली सर जो 2 साल वाला बच्चा होता है ना, सो वो जो है वो एक्चुअली में देख पाता है, उसको एम्ब्लायोपिया सेट इन नहीं हुआ. सो वो जो आपका मोमेंट था ना, वो एक्चुअली में ट्रू मोमेंट था. सो हमें क्या लगता है यार, 2 साल का बच्चा कैसे देखेगा, इसको तो एम्ब्लायोपिया हो गया होगा, इसको तो ये देखने में ही बहुत टाइम लगेगा. बट उस वक्त नहीं सेट हुआ वो. उस वक्त आपने जो उसको दिया, उसका एकदम से वो क्लैरिटी आ गया और उसको लगा वाओ. सर अभी जस्ट मैंने ऑपरेट किया एक 14 year old गर्ल, बोथ आई विद कैटरैक्ट, एंड इट वाज लाइक अ लुकिंग लाइक टू मी अ कॉर्टिकल कैटरैक्ट, जनरलाइज्ड. सो बच्चे को पता नहीं चला, मदर ने ध्यान नहीं दिया, दे केम विद मी लाइक सो मच इफ एंड बट. सो आई शोड देम, मैं रेटिनोस्कोपी उसको कराया. मैंने कहा तू बैठ के देखो यहाँ पे कि बच्चे का ग्लो कैसा दिख रहा है. फिर मैंने अपने स्टाफ को बिठाया, मैंने बोला इसका ग्लो देखो. बोले ये तो बहुत डिफरेंस है, इसको तो कैसे ही दिखता होगा. एंड ट्रस्ट मी, आई जस्ट डिड अ रूटीन कैटरेक्ट सर्जरी and the child came to me and say, now I can see lines on the floor, there is lines on our floor at our house. So mother was like so excited just to hear this. Sir, if you see squint post-ops, no, these boys and girls, they have a different heroic moment altogether. They're like, now I am like superstar. So their confidence, you can see them like when they come with the squint, and when they come operated, they're like full too. So I love to see that confidence in them. That gives me that confidence ki, I am doing a okay job.
Yeah, that's true. I agree.
Sir, with AI in ophthalmology, sir, how it will change ophthalmic field?
It's changed so much that today's podcast, all the question answers I actually saw on AI.
Sir, even I prepared this podcast on AI.
चल इसी बात पे yes हो जाए. नहीं, but the most important thing about AI is that AI will stay and it's artificial. वो वाला word लोग भूल जाते हैं. It's not intelligent, it's artificial. And I think, but the problem is now, the thing is that the use of AI, if somebody would ask you 1 year back that everybody, almost every second person in the urban area is going to use AI for the daily activities, you will say it's not so fast. It'll take some time. to come. But what we are seeing is a huge change. Every year, I think there will be a massive amount of change and implementation on AI. AI is such an important, in our conferences and everywhere, in our daily activities, AI is having a huge role to play. But the biggest fear and the challenge which will be in ophthalmology or any person, especially the residents and fellows who are learning, AI is going to be part of their learning now. And the big problem will be they should not become AI dependent. They should use AI as an assistant, but they should use their own mind to understand the cause of the disease. AI can tell you what, but if you don't ask why to yourself, you will never remember, and you will have a mental atrophy. And unfortunately, this will happen in the future. And if I don't know what Mayank and Chirag feel about this, but I think this is something to be a little concerning in general. That there is a inherent tendency of a human being to become lazy, like ordering from Blinkit.
Right.
Everything you want in 10 minutes. Now, if in 10 seconds, if you have the answer, why will you search a journal?
Yeah, absolutely.
Why will you take the effort? You can just type in everything and the answer will be there in front of you with all the research done. But then you're not applying your mind to it. And that is where the problem will lie. When you don't apply your mind for a long time, like every part of the body, your mind will also become shrunken and atrophied.
True. It's absolutely agreed. AI, what I feel is it's definitely here to stay. Again, हम लोग उसको कैसे use करते हैं, it's important. Again, like we discussed earlier, कि if we are totally dependent on AI, the results that the AI are giving, then we are in soup. So we have to filter out the results given by AI on the basis of what the actual human being is. So it is a very good diagnostic screening tool. If we start relying that screening criteria as the final one, then we are doomed. So one of the application is diabetic retinopathy screening. So there is a product that is in development with the use of AI. All the patients that are coming to a hospital, not necessarily an eye hospital, a multi-specialty hospital, where you would have a lot of patients with diabetes, hypertension, and those kind of things. So there will be an AI model which will detect, which will image the retina and see what are the prediction for diabetic retinopathy and other diseases. So it can be used as a diagnostic screening tool, but if the model says that the patient doesn't have diabetic retinopathy and we don't go to a retina surgeon for a screening for the further evaluation, then it is not correct. So it's basically to detect earlier cases and to check for what is the severity of the cases by an actual person. So those kind of things. So it depends how we are going to interpret the results of AI. If we are going to totally be dependent on AI, then it is a bit of problem.
So AI पे dependent तो नहीं रहना है, ये तो हमें पता ही है. But AI in ophthalmology is very, very important, and it will stay, I think, more than any other branch. So why? Because AI is there in the teaching. So now we are able to show what we can see. So now with the help of technology, the residents can actually see the surgery being happened, which was not, present before. So AI in diagnosis, like as Dr. Chirag said, diagnosis is very, very important. And there are these so many newer technologies which are coming in. I am using AI in diagnosis. So I am not a cornea expert as Dr. Chirag. So when I have a pentacam report, when I am in soup, I just click its picture, send it to AI, give the patient details. I say, just tell me if it is keratoconus or not. So, because these many data points I am not proficient in, but I take that help. So, AI in diagnosis is gonna be there. But it's not foolproof because AI is being taught by us only. We are only teaching AI. Okay. So when I put in AI that how much undercorrection in a pediatric cataract surgery I have to do, it gives me the opposite answer. And if I rely upon it, I would end up in giving a, double amount of refractive error in the opposite direction which I want to. And it's still there. So I checked it multiple times. I keep checking on it on 6 monthly basis, whether it is correcting or not. It confuses the undercorrection and overcorrection. It's still there. AI in management, so clinical management, AI takes the toll out of you. These EMR systems are there, and so many things which are here. I want to develop a update that so and so technology is available with us. I give command to the AI. I actually use two AIs. I first tell one AI to give command to the second AI. So then it gives me a very good prompt for the second AI and tell them to generate this prompt from that. So that is how I use it. So I don't have to spend lakhs of budget on digital marketing or something like that. I am happy with it. So AI in management, clinical management, so that is perfect. And the last part is AI in the treatment, the surgical part. Yes, definitely. AI would be there because it helps the surgeon. One technology we already know, that toric IOLs. So now we can actually calculate the astigmatism in our eye and give you that unparalleled 6/6 vision, .00 refractive error. That is with the help of AI. So it calculates everything. It gives you that formula from lakhs and millions of formulas which have already been used, and gives you that precise amount, and that is for our help. So we use different formulas and see which formula is perfectly fitting into this patient eye, and that is with the help of AI. So definitely AI is gonna be there, but yes, we should not be just dependent on AI. AI is the only thing. If AI बाबा बोल रहे हैं तो वो ठीक होगा, नहीं जरूरी नहीं है.
I think what we forgot is the patient also has AI.
Right.
So when the patient comes with his disease, he's already typed it, and now he will type it in the future, and he will know what the diagnosis can be and what the treatment can be and why should this treatment be. So he can also come as a person who will not tell you, but he will just check how and compare your out interpretation to what he or she has with him in AI. And if it does not match, he might even tell you on your face, saying that I thought this is the treatment that is required, and why aren't you giving me this treatment? So I think we need to be a little prepared on that perspective as well, because in the places where we practice, Delhi NCR, we will face this challenge in the future.
Sir, have you ever faced this challenge कि customer came, like patient came from कि यार AI में तो ये बताया है ChatGPT
So
ने.
daily basis, the patients actually click a picture of their eye and ask. Yeah, you can actually ask ChatGPT to see what are the problems here and there. So obviously it will give you a paragraph sort of thing. So one of the patient came with a condition called pingecula. So it's a very benign, non-problematic condition of the eye where just there's a yellowish deposition on the white part of the eye. It's known as. So the AI gave him so many options, and it keeps on giving you prompts. Do you want me to do this? Do you want? So he landed up with a diagnosis of cancer, eye cancer. So he came with a panic. So I had to spend 10 minutes showing different photos, clicking picture of his eye to see कि भाई ये normal चीज़ है. Don't worry about it. It's a cosmetic problem, and we can remove it in a 10-minute surgery if you want for cosmesis, but it is not a disease. So those kind of things are there. We are regularly, I think all of us are facing those challenges now.
Sir, what I feel is कि even I use AI, but not for the this clinical part, but it tells you what you want to know. कि जो भी हम पूछते हैं ना वो उसी का ही आंसर देगा. If we say कि ना इसके तुम गुड चीजें बताओ, like tell me pros, वो pros बता देगा. Tell me cons, वो cons बता देगा.
AI pampers you a lot. That's the truth, that's the reality, and that is how they work. Because if they don't pamper you, if they keep scolding you, why would you use it? So, adding on to Dr. Sethi's experience, I actually use that information of AI to actually for the patient. I tell them, you take this diagnosis which I've written, okay, and so I deal with children and amblyopia and squint surgeries, which is like a lot of myths about it. So I tell them, you just Google this particular word. I tell them, you Google amblyopia, or you Google meridional amblyopia, or you Google the congenital esotropia. So I tell them, if you don't want to Google, just click a photo of my prescription and upload into ChatGPT and ask the ChatGPT at least you'll agree to the ChatGPT Baba. So ChatGPT, what ChatGPT is doing? So ChatGPT is actually learning from my prescription. So whatever I've written, whatever advice I've given, the ChatGPT incorporates, or the other AI for that matter, that incorporates into the future decision makers. So actually, I use this information to feed the AI for the benefit of the people who are dependent on the AI, so that the AI does not interfere with our treatment. So
So AI is a spouse which you like to keep around always. Tell something good about me.
yes.
Sir, it's more like a addiction for me. Like, you guys are doing like uploading the prescriptions and everything, uploading the photos of the eye. Sir, for me, it's like when I'm feeling bored, ना, I just talk to ChatGPT कि यार चल कुछ बात करते हैं, देखते हैं कुछ अब like if I want to prepare a podcast, like what I'll do is कि यार मेरे को I want to do this kind of a podcast. I want this. I want this. Just tell me what I can do. It will give you very great answer, but practically it is not possible. I have seen it today.
You must
Practically.
have searched, tell us the top three ophthalmologists in Delhi NCR. That's why you've seen me and Chirag and Mayank here.
So while this talking thing is no, it's actually good in ChatGPT. Whenever I go for a long distance thing, no, I just put on this talking mode of ChatGPT. It has a very good responsive timing. You know, you just talk to it, and it feels like you're just talking to a co-passenger. And it has a sweet voice also of a female. So I don't know, maybe Gemini has not come up with it yet. I have not used Claude at this feature, but ChatGPT is good. I just talk to ChatGPT, I am going to this. I just want to manage this thing. Just suggest me something which I can do it better. It gives me sometimes random answers, but sometimes it, hits the spot. So that is something good.
So, sir, अब जैसे there is one landscape in present ophthalmology that there is a very much rise in corporates. And, sir, you all three have your solo practices. So, sir, what measures you take to, I won't say like compete with them, but sustain your practice with such corporate pressure? कि एक market force है, corporate, they are on rise, they can spend a lot of money on marketing, which solo practitioner cannot, don't have that resources. So sir, what measures you will take?
So right now, the only thing that is sort of missing in medical field is the trust between the physician and the patient.
Right.
Everywhere we see that the doctor doesn't give time to listen to our problem, to give a personalized treatment and those kind of things. So when we go to a large volume setup, maybe a corporate or anything, they have a huge capex. They can invest in lot of machines, lot of building infrastructure and everything. But somehow, because just of the volume, I'm not saying that they don't want to do it. They're not able to do because of the volume. They have to justify that capex for the volume of patients. For solo practitioners, we don't have that much capex and operational expenses. So our volumes are less. We tend to give more time to the patient and try to understand. So what I feel ki that is the niche that we are creating by building a trust with the patient. So that trust goes on with our treatment planning, the thing that what patient wants from the surgery, if at all it's a surgery. So those kind of things, I think that will go a long way in, I would not say competing, sustaining in the present scenario. But yes, capex would be required. So what I feel long term, there should be collaboration between different solo practitioners coming together, so that these capital expenditures, statutory compliances, those can be shared, and individual patient trust and the patient base would be the winning factor.
So sir, it will be most like a group practice
Group
model.
practice kind of thing, yes.
It will sit above solo practitioners but sit below the corporates.
Yes.
So also, I would like to add, these corporates, they are doing a pretty good job. So I don't see them as a competition. What they're doing is they're creating awareness. So more and more people they are bringing into the market those who are searching for a proper treatment. So let's say a person is looking for, I would take my specialty, a strabismologist or a squint surgeon. So now they have created this thing that this thing is treatable. And when the person knows that my squint is treatable, they'll search for a squint surgeon. And that is where I do come in. Yes, they're doing a great job. And as Sir said, they have to respect the volumes. But due to this thing, somehow, sometimes the patients are not satisfied. So that is where we come in, we chip in, we give that satisfaction, we build that connection, and we give them that personalized, individualized treatment for them. So we have to look at their pockets also, we have to look at their families also, we have to look their so and so. So somebody would say that they are not interested in getting operated here in this city. So we sometimes have to see how they can do it in the other city as well. Who will take care of them in the other city? So that is where corporates, I think they are, creating more and more awareness, and solo practitioners should not see corporates as a, opposing force or something. It's like we are building it together.
Right. So what's your viewpoint on that?
I feel as a private practitioner, or as a solo practitioner, the aim should not be to outscale. You cannot outscale a chain of eye hospitals. You cannot outscale a corporate who has deep pockets. But what you can do is you can outcare.
Right.
So what you can do is you can build a niche. And with that niche, with a disruptive marketing, because of the niche, like you can create a boutique hospital of yours, which caters to patients not just with ophthalmology, but with luxury. So nowadays, patients, the place where I am in Gurgaon and Delhi NCR, patients demand an experience. They don't just want to come to an eye hospital. They want to come and they want to be pampered. They want to not wait for a long time. They want to sit in a beautiful sofa like I'm sitting in and enjoy a nice coffee while they're waiting. And they don't want to wait long. Otherwise, they'll put a bad review for you at the end of the day, even if you do a good job. So, luxury along with ophthalmology and building a boutique hospital is somewhere you can always create your own brand and your own niche, even if you're a single practitioner, and you can do well in that particular segment. So, along with the corporates. So, as Dr. Mayank said rightly, you don't have to compete with them, but you have to create your own space.
Own space,
Yes.
right. So, sir, जैसे there is, sir, nowadays, sir, there is 99% accuracy in surgical outcomes. So, sir, what do you guys think? Will brand become more important in future?
So 99% accuracy, 2-minute cataract surgery, which is painless, stitchless, bladeless, is a myth. It's not 99%. Every case is different. We
Right.
all know that. Dr. Mayank, Dr. Chirag. So what we need to put down is, I think the doctors itself have created a bubble, a commercial bubble. Not just doctors, the corporates have, in which they're marketing to the patient every day. If you read a newspaper, you open, there will be ads of ophthalmology brands which tell you that this surgery is nothing much. Whatever degree, whatever you've learned, especially for cataract surgery, it seems to be a very easy procedure in which patient will definitely get what what the outcome will be 20/20, and every patient becomes very demanding because of this. And basically, then you're a human after all. After with all the technology backing you, you can still have errors. You can still have a surgical complication. Everybody has it. We all go through it, even still, and it will happen in the future as well. And so the patient will always have a higher expectation because of the brand that you build out, the bubble you've made. So I think the best, the most sensible way for an ophthalmologist in the future would be to actually tell them the real thing, that it takes around 10 to 15 minutes to do a surgery, and everything is not very rosy. It's a good surgery, it's a very accurate surgery, but then it varies depending on how your case is. And that's very important, that the patient should know that whatever is mentioned in media is not true.
So that's where the role of personalized treatment, customized treatment comes in. So when we say 99% accuracy, so we can only measure finite data points finite parameters that are calculated on the machine. Our vision is not just that. So when we see, it is not just 6 by 6, it's 100%. We see color, we see contrast. We have to have some sort of depth in the eye. So I can give a 6 by 5 vision after a cataract surgery, but the patient might be very unhappy because his 90% work is on WhatsApp and he's not able to see that. So then what's the point of doing a accurate, super precise surgery? It's not that. So again, in those things, we have technology available with us. We have all the sort of IOLs in the world. The costliest IOL doesn't mean that it is going to give the best vision. The best vision is how it suits the patient's need. So that's why it is very important that we are going towards a personalized treatment. So that is, I think, the way forward, and technology is just going to help us in that.
So to add on to Dr. Chirag's viewpoint, sometimes like when we were trained, no, we were taught, like as sir said, that 6 by 6 vision is the ultimate vision. That's not true. 6 by 9 is a practically very very good vision. And there are some patients जो हम देखते हैं उनको हल्का सा refractive error होता है. They're okay in doing their job, and because of their mild refractive error sometimes they're able to read also. So practically they do not need any glasses, but if we force them, you have to get the glasses, you have to get the distance glasses, you have to get a near glasses. I'm talking about some patients, not all the patients. So those patients, they are very troubled. They're like everybody have been to, they have said you have to wear glasses, and I'm not able to wear the glasses, I'm getting headaches. So sometimes we have to tell them, oh, it's okay, you can take off the glasses, it's fine, your vision is fine. So they need that reassurance. Coming that from a eye surgeon is very difficult, because everybody is like, if you are having something, you need to get it corrected, but it's not always the case. So I would say that you have to look into that scenario. Sometimes you have to look at that, okay, she's a housewife, and she doesn't do much of a reading. That's okay. If she doesn't want a near glasses, it's okay, it's fine.
And I'll tell you, glasses are not villain. Basically, the reverse is also true. So I tell you from my experience, one of my very senior patient, he's a chartered accountant. He's been using glasses for the last 57 years. So I did cataract surgery. The patient was glasses free. He was 6'6". But the next month I see him, he was wearing glasses. तो he said कि यार जब तक मेरे ना कान पे वजन नहीं पड़ता मुझे दिखता नहीं है तो मेरा दिमाग नहीं काम करता. So those kind of things. So we are chasing accuracy in terms of numbers, but the patient might not feel the need of removal of glasses. He might be happy with the glasses. So he wears glasses just for the heck of it. And his simple explanation was that कि जब तक मेरे कान पे वजन नहीं पड़ता मेरा दिमाग नहीं चलता. So then that's fine.
Sir, it's more like the problem is psychological, not the accuracy one.
Absolutely.
So, sir, nowadays, the person who is doing residency and have opted ophthalmology, from your experience, what is the mistake they are making and how they can avoid making it?
So that's a very good question, because we've all been through that process. But what I realize is one thing that ophthalmology training in India, at least what we know of, does not teach you. It teaches you all the clinical skills. It does not teach you how to manage finances, and how to build your own setup, and how to manage your own practice, how to respect your colleague who's next to you, because these are something which are very very important things which you learn by making mistakes, and by crossing the hurdles one by one, how to make a NABH setup. So I think these are very very important things, and how to invest in the correct equipment, what you should buy and how you should buy it. Should you buy it in a group? Should you buy it as a single practitioner? Should you actually not buy this equipment initially and under peer pressure? And we all have made the same mistake. I may have not made the mistake because my family was already having a hospital, and they were more mature and they already knew that time. So when I joined the practice, the equipment was there. But I think Chirag and Mayank were now had made the practice from scratch. they understand is much better. That there would be certain things, certain decisions which they now may, in retrospect, they may not have made that time, and that has made them more mature, I'm sure.
Absolutely. That I agree 100% with Vaibhav on this. So, at the end of the day, obviously, finances matter and matter in building up one center, building one setup where you want to give quality treatment. But as we said, there is a capex involved. So, in what a stage of your practice you should invest in what kind of things? If it is sort of a mentor kind of thing with that, so it comes in very handy. So if you have, I have been very lucky to have some mentors who have been guiding me, seniors, to invest logically and not just go full through. So those kind of things are there. That is very important. So I think if that can be incorporated in the residency, that will be very helpful.
Finances are one thing. Other thing which is not being taught in residency is, how to talk to a patient. So they are being shown, okay, this is the case of a corneal dystrophy, this is the case of a retinal detachment. And you go and see the case. And what everybody would do is there are 10 of the residents, they'll jump onto the patient and they'll shine the brightest light ever possible into the cornea, and they'll see him for at least 10 minutes each. So they'll see him for 1 hour. Just imagine what is going through with the patient. So you have to respect the patient. You have to know how to talk to the patient, how to build a rapport with the patient. I know it's a very very difficult, residency में नहीं हो पाता है, time नहीं है, but at least for one patient we can do it. So just try it with one patient. See how to introduce yourself. So in US, if you would have known, you would first introduce yourself. I am Dr. So and so, and I'll be doing this. So do I have the permission to do that? So that is the first opening statement. Here, what we do is we jump onto the patient. So that is not the way. The patients, they're there for us, and we are here for them. So we have to respect them. And I think learning and respecting should go side by side. So like one of my institutes, they taught me patient first. That was something which has been with me since ever. So now wherever I go, always patient first.
So sir, this thing like जैसे ophthalmology में like there is clinical education involved, but business and we can say कि personality development की education it lacks. So sir, it is with every medical branch.
Yes, that's true. In India, at least. And that is one thing which is very, you have to become, after all, you're training somebody to go back into the world and start their own practice or do a practice, and that is where you need to train them. Also, I think it is a responsibility of the institute with time, and it should be incorporated through the various channels, that how do you guide the person, handhold them so that they don't have the same issues. Everybody goes through the same steps. They don't know what to buy, what is the best cost, because it is like the same machine. If I buy the same machine in Delhi, if I buy and the same machine is bought by a larger institute, the larger institute pays 1/10 of the price than a private practitioner pays for the same machine, and that is a very huge amount. It should actually be the other way around. The private practitioner who has less financial reserve should be paying 1/10 the price, and the institute that has the reserve should be paying the premium price for it. But it happens the other way around, because the institutes have the muscles to flex. So they have the volumes with the private practitioner, and they have the guidance, they have the experience. So that same experience should be transferred to the ophthalmologist, like Dr. Mayank and Dr. Chirag would agree to me. What is your take on that?
Yeah, absolutely. That is true. But somehow I feel that price of machine doesn't impact the quality of care that we are giving. So at every stage of life, there are two things about a machine: the accuracy of the machine, that by which it's calculating whatever diagnosis it's giving, and the second part of it, the speed which it's doing that. So in a starting practice, if the numbers are low, so we don't need to go to a machine which can deliver like 10 results in a minute, right? or we call it the use case, right? So if there is a machine which can deliver the same amount of accuracy but it takes slightly more time, or it is not that much user friendly, so I think that should be preferred instead of going a costlier machine, because many times the costlier machine would have some extra features of a touch screen, of giving a very detailed printouts, those kind of things. So that is not necessary all the time, because it's not solving any purpose either to the clinician or the patient. So those things, those finer nuances do make a difference in the initial years of practice when we are developing the practice. So that's why we don't compromise on the patient care as well, and we take care of the finances as well. So that is one thing that can be done.
So to add on to Dr. Chirag's point, I would say that machine is not the only thing. So it's not the machine which is treating the patient. It is you who are treating the patient. Machine is there to help you. So machine helps in visualization. So we were diagnosing keratoconus when topography was not invented. We were treating it at that time. So we should know that skill that this is something which is there. Machine just helps us to make our decision much more crystal clear. Yeah, this is a disease A and this is not a disease B, something like that. So I would say machines are there and we should respect technology. Like, it is there to assist us, but we should not be totally dependent on the machine. I do not have a machine X with me, so I cannot do this procedure Y. You still can do it. You can do it much better. So if you would agree, SICS, which is small incision cataract surgery, now which is being sidelined, would actually might give a better result in a particular kind of a cataract than these bladeless and sutureless cataract surgeries. So we should not be like we don't want to learn that older technology. No, we should gradually learn from the older technology, see its result, and we should have that thing in our armamentarium. Like we know this also. If this kind of a case comes, we know this also. So we might not need machines for every case. So I would add to it. So machines are, yes, definitely helpful, but please do not practice just on the basis of machine.
And sir, on dealing with patients, sir, what you all can give the best piece of advice to the surgeons who are opting ophthalmology?
I think one thing, uh, being there for some time in practice after training, what we have learned. I think what one skill, the most important skill, is when not to operate a patient. Because doing surgery, the skill we learn, but which case we think if we operate, the patient may not benefit and patient may actually worsen and may become a problem. That skill has to be mastered, and that only comes with experience and understanding each case, each clinical scenario. So when not to operate a patient, and when you master that skill, when you understand that this patient, you have to let go of certain things, and counseling a patient, counseling, these are two very, very important things that you learn when you start practice and when you evolve as a practitioner.
Yeah, I totally agree. And just to add to that, with an example, like I do cornea transplants. So transplant as a procedure is considered like, obviously, a patient who is blind would be able to see. But God has given us both eyes. So it's not necessary that every eye that doesn't see need to be transplanted and so that the vision can be restored. The reason being it's a transplanted eye. So the patient need to do a follow and do medications, regular medications to maintain so that the body doesn't reject that eye. Okay. So if there are constraints, like if the patient is very old, he is not able to walk, he is managing his life very good with one eye, adding a transplant to that patient is going to increase his suffering. He would be able to see from the eye, but his time would be spent more on follow-up visits, putting medication on the for the graft survival and those kind of things. So for a patient which is perfectly seeing from one eye, he's managing his own work. It is not necessary that just because I know how to operate, I now know how to do a transplant, I should be operating that eye. So that kind of conversation we should have with the patient. The younger surgeons should know that these are the patients. You should have detailed dialogue with these patients, that when the surgery is actually required and when they are better off without doing the surgery.
Mayank, you're right.
So I actually forgot the question. The question was like younger surgeons should know this thing.
On
Yes.
dealing with patients, sir, what younger patients can learn?
So I think dealing with patients is humility, I would say. So these are both excellent points, and yes, they do come with an experience. Uh, what I have seen and what I'm learning now is, you have to be humble and you have to respect the person who's standing in front of you. These are not just two eyes. This is a whole human body. So what I do on daily basis is sometimes neuro-ophthalmological problems. So the problem is somewhere else. The manifestation is there in the eye. You know, pediatric syndromes. So the child is born with a particular genetic syndrome. We are seeing some sort of thing in the eye. So you have to take care of the patient as a whole. So rather than just treating the eyes, I would like to say that please, go back to basics. Just think of your MBBS days, see the patient as a whole. Don't discard that, okay, you have a heart condition. No, 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 no. That is your prime thing. Okay. Don't run into doing an eye surgery. So, first clear your basics. Patient health is on priority. Then come to the eye. So, this is what I would tell them to please, get yourself reminded this thing. So,
Okay, I'll just end ophthalmology segment with my last question, which is ki, what are the future skills young surgeons need to have in the age of AI?
future skills.
Right.
So future skills, so it has to be learned, no?
Yeah. Yeah, like kind of ki, what skills they need to incorporate in the age of AI.
See, in the age of AI, I would say stick to your basics because AI is running, like anything. So suppose if I'm having, let's say I'm a resident, and if I have a patient of Dr. Mithil would add to it, I have a corneal dystrophy. That time we used to read Krashmer, and you need to read the whole chapter, and maybe look at all the review articles on those things. But now you can just type, just tell me about this thing. So no, that is not the way to do it. You cannot just upload the photo and ask the AI, tell me about this thing. So they need to still know the basics because AI is not the ultimate thing. AI is learning from us. That they have to understand. It's like a KBC mein public opinion. So what everybody thinks is what AI thinks. So it can't be always right. So I think I would still say stick to basics. Learn what you are doing, what you are seeing, and how you are doing it. So that is the basics. And AI will definitely, when they come out, definitely everybody will be, pro in everything. But until unless they know, they will be in a soup. They don't know what to do. So maybe our residency was such that I can still see a cornea case and I can handle, 60% of the cornea complications, 40% which I know I cannot handle it. I would refer all the retinal complications. At least my referrals would be a quality referrals. Just a mild NPDR, I would not refer to Dr. Sethi. I would say, okay, I need to see you every 6 monthly. No, it's not like that. So AI will tell us, okay, no, it's a retinal problem, send to a retina specialist or something like that. So you should know your basics and then use the AI. AI is not the ultimate thing. This is what I would say.
Yeah, I totally agree, and I'll add to it that we interact with a lot of residents during our course of conferences and all. So AI projects a very fancy picture of the treatment. There are a lot of advanced treatments that we discuss, but the basic treatments are still there. Are there for certain cases, and they have to be done that way. There would be instances when you would need to do a physical suturing of a trauma case. No matter how AI gives the predictability ratio, you would want to take chance with that patient. And that time, your surgical skill will matter. So many a times, what I feel the younger surgeons, your younger residents, they say, "Oh, it's not necessary now. We have seen this kind of surgery. This is what I want to learn. I don't want to learn the basic one." So that is probably not correct. So that is, they have to learn that they'll have to learn the steps to reach the final fancy world of AI generated treatment plans. So that is one thing that is going to stay.
Exactly. Building a foundation and being human and interacting with humans will never change, at least in the coming future, hopefully, till robots take over and aliens come. But till that time, machine is machine and human is human. And AI is still AI, it's still artificial. It's as intelligent as we want it to become. Until that time, you require humans, for empathy, for ethics, and for having a human approach to things. AI will tell you a lot of treatment modalities and diagnosis, but you have to counsel the patient and you have to operate or treat the patient. And that's where the surgical skill and the understanding of and being a compassionate doctor, like we all are, needs to be. As a young surgeon, you need to learn that you must learn AI, but you must also understand that you have to learn the other important skills, which are more important than AI during your training.
So now let's move on to another segment of the podcast, which will be a total casual and philosophical. Sir, these are the questions which I want to ask. Sir, sir, how do you define success?
So I think I think we all will answer this question in our own way, and that indicates that success has no definition. And success means that I think what we will not see, we are all practitioners, and everybody has the grass looks greener on the other side. You might feel success means doing multiple number of surgeries in a day, or you might want to do might want to be the topmost ophthalmologist in your region. But I think your success should be defined by what you're doing every day, and that will keep you happy. If you're going to be doing a good cataract surgery for one patient also, even if one patient comes in the OPD the whole day, you may not have many patients. And if you treat that patient well and you do your best, even that is success. That's not failure. Even if you don't operate a patient and refer him to a senior surgeon who's there and the patient gets a good treatment, that also is success. Because the patient comes back to you and thanks you that you've done the right for the patient. You may want to do the procedure, but you know that it may not be the best approach in your hands. It may be a better approach in somebody else's hand who's more experienced. And you may have to let go of your ego. And that is the thing. So the success and ego are directly proportional, inversely proportional. The more ego you have, your success definition also changes. So, everybody cannot become the topmost ophthalmologist in India or in Delhi or in Gurgaon, but you can be a good ophthalmologist and be known for your work with word of mouth.
Sir, ego का क्या है कि like it comes from a sense of achievement. There is a small achievement na in my life. Suppose if there is a small achievement, sir, ego develops. सर कैसे एक 27 साल का लड़का ego ना डेवलप हुए with small sense of achievements, what he can do?
No, you should have a ego, If you have achieved something, you should rejoice it. But you don't let it sit over you. So success, as you said, that success for a 1-year-old child is standing up. You're able to stand up on both of their legs. Success for a 2-year-old child might be, talking to their parents that they want this thing in a proficient language. So success for a 10th class going person is, just passing the boards. So success has different meanings. And still, success would be different in different days. What I assume right now success is, sleeping peacefully at night. So that is success for me. If I'm having a good night's sleep, that is success. My day was successful. So this is how I define right now. I do not know. Maybe I would change the.
Someone snores at night.
No, absolutely true. Success is everyone has different meaning. Every stage of life, as Mike said, you will have different meaning. So at our stage, probably my stage, I would say overcoming that ego of materialistic thing, like doing a very great surgery, give me an ego boost. But if I am able to overcome, that's my success. Because at the end of the day, if I've seen 20 patients, if I've operated 20 patients, if I've given my best to all of those 20, that is success to me. So whether some were failures, some had complications, and some had super results. So if I am able to give my best to all those 20, that is success.
And I think social media has a role to play in success nowadays. The problem is that we are all hooked on social media, and it's not just us. As a human, you have a tendency of seeing what the other person is doing, and you try to project your best self. You may have done 20 cataracts in a day. You like to post that. You may have done 20 vitrectomies in a day, but nobody posts their failures in on social media. That today I had a bad detachment. Today this patient surgery went wrong, and the patient left my clinic, was unhappy with me, gave me 1-star review. Everybody has it. So what I mean to say is that social media has changed the definition of success for a lot of people, and that's called pressure, social media pressure, where you also want to do, and that's what drives the companies and marketing also. By being the first person in India to implant a particular lens, or first person in a district or the city or the sector to implant, you'd like to show that. But that is not a definition of success. That's a pseudo success that we'll all agree to. But more importantly, as Dr. Chirag and Dr. Mayank said, the success definition means you should be happy, and other person also should be equally happy with you.
सर अब ऐसे होता है ना कि लाइक व्हेन यू आर इन योर 20s ना, लाइक आई एम इन माय 20s, तो जब एक लाइक जब हम 20s में हैं सर, इट्स लाइक कि हमारे गोल्स होते हैं कि ये अचीव करना है, ये अचीव करना है, ये अचीव करना है, एंड यू गाइस आर 30+. सर
We are
अ गाय
still less than 20 years. I haven't celebrated any birthdays after that.
सर मेरा ना क्वेश्चन बड़ा ना थोड़ा सा ना है कि लाइक अब जैसे जैसे एक बंदा 20s में थिंक करता है सर, उसकी थिंकिंग किस तरह इवॉल्व होती है व्हेन ही क्रॉसेस 30? डज इट चेंज कि अब मेरे को ये अचीव कर, थोड़ी स्टेबिलिटी आ जाती है लाइफ में, क्योंकि 20s में कोई स्टेबिलिटी नहीं है, बंदा सिर्फ भाग रहा है लाइक अ हसलर टाइप. तो सर वो जो स्टेबिलिटी आती है, हाउ यू गाइस थिंक, दैट्स व्हाट आई वांट टू
So
नो.
first you have to get married. Okay.
30s part Mayank will tell, 40s part we'll tell.
So first you have to get married. Trust me. Okay. So I was like this, bachelor, caring for nothing and, doing whatever I want. I was one of, I don't know, I should not be proud of this, but I was able to ride my bike through any traffic and, reach any part of the Delhi within like the shortest time possible, but I had to face a lot because of that. I had 2 major breakdowns, 2 major accidents because of those things. That risk-taking behavior was not yet stopped. But once I had a child, I did not. I never crossed over 45 in any of the two-wheeler. I could not. I just could not. It's like, what you're saying, those 20s, they are a different adrenaline rush. And you have to direct that. See, you have to be befikre there. But at the same time, you do not have to fly so high so that, you don't touch your roots. So you have to stick to your roots. आप करो आपको जो करना है. लेकिन within the limits. So as you said, ki if you have achieved something, that ego will develop. That's a very, very good thing. You should develop. You should actually rejoice that, I have achieved this thing.
बट सर ऐसे होता नहीं, ये घमंड ही मार देता बंदे को अगर
वो
ईगो
ही नहीं
डेवलप
होने
होगी
देना,
घमंड मार देगा
वो ही नहीं होने देना. मैं तो यही बोलूँगा, वो ही नहीं होने देना. मैंने अभी और अचीव करना है, सो आगे का ज्ञान यहाँ से मिलेगा.
And I think what you said, na, the word ghamand, I think Chirag and I will agree to that, that you must also start respecting and you must also start highlighting your peers' accomplishments. ये भी बहुत ज़रूरी है. I think if Chirag does a good transplant and I say really good job done, man. So you feel also that you don't always have to have competition.
राइट राइट
It should be a healthy companionship or a brotherhood shape that everybody is doing good, well in their life. You don't have to compete with everybody,
राइट
but you can be part of the team. And that's where the teamwork comes into play.
Exactly. So that is when stability as such comes in. When you don't feel that यार होता है ना, मैं ही हम है तो क्या हम है, तुम ही तुम हो तो क्या हम है, वो वाला जो है. तो इस तरह से when you feel that everybody is doing good work in their own field, you're not competitive enough. Still, you're excelling in your old self. You're making you are competing with yourself. So that is kind of stability that I think we are having right now.
That should be there. We're not ideal. We all have bouts of ego. I'm sure everybody. You're human after all. And then we learn from that.
सर
We learn from it.
like
Our complications, our mistakes teach us. So that brings us back to ground. Every time we try to fly away.
now there is one thing which I face, like in present scenario what I am facing is ki, like I am doing an action, right? I am working, like you guys are also working as surgeons, like I am working as a businessman, as a sales guy. I do have a direction in my life, but I don't have clarity ki, like where I will land. Sir, how can someone develop that clarity?
That clarity does not come.
It will never come.
It comes. It comes. It comes with time. With time, and I think the clarity comes once you will realize. I think with time we all should realize that you're on the right path when you feel happy and when you're touching the people's lives and they also feeling happy along with it. That is the way you should choose. When you're most comfortable, as Mayank said, you're able to sleep at night peacefully, or you're able to do the best for the patient or for the customer, in your thing, and you're excelling in your field, and you're trying to excel. That is when the clarity
Arrives.
arrives.
But why do you want a clarity?
Sir, it's like ki, there are. Sir, have you ever faced this thing ki, like when you are at a point in life when you are seeing two roads, one's
Always.
going there, one going there.
So, a medical graduate is not sure whether he will get an MBBS seat or a dental seat. So, he's sitting at the counseling and he's not sure for the rest of their life he'll be called a, general physician or a dentist. After taking a MBBS seat, they don't know whether they would be called a, medical person or they would be a surgeon. After being a surgeon, they don't know if they want to go into an ophthalmology or an orthopedician. So after that, they don't know what branch they're going to choose. They're going to be a cornea surgeon, they're going to be a pediatric surgeon, they're going to be a retina surgeon. So that clarity never comes. You actually cannot sit, at your 20s that, I want to do this. You will achieve that someday, but you should not. What I believe, what mantra I have is, the decisions which you have made, you should not never regret it. Make a decision that it was your decision and you should never ever regret it. So that whenever you look back into the life, you should not say कि अरे वो उन्होंने ऐसा बोला था, मेरा तो मन नहीं था ये करने का. No, that should be your decision. And then whatever you'll do great. So वो एक है ना जो लक्ष्य मूवी में है, अगर आप घास काटने वाला बनो तो ऐसा घास काटने वाला बनो कि आपके जैसा कोई और ना हो.
I'll tell you, this will happen at every stage of life, day in, day out. The best is to take one step at a time. So there's a reason why it said take one step at a time. So I tell you, when I opened my practice, so I have to cross those crossroads almost 10 times in a day. In a new practice, you have to do everything. You're managing the staff, managing the inventory, handling the finances, handling the everything. So many a times, junior staff would come and ask you a question, whether we should do this or that. You don't know what is the end point of both these things. How do you take that decision? So those kind of crossroads you come multiple times in a day. So the idea is just take one step at a time, then go with it. As Mayank said, don't regret it. You have taken that decision. The path will choose yourself. It's just the way how it is.
सर मेरे को ना एक क्वेश्चन लाइक इट जस्ट केम ऑन द स्पॉट कि लाइक जैसे यू गाइज आर मैनेजिंग योर प्रैक्टिस एंड यू हैव अ टीम ऑफ पीपल सो नो एज अ लीडर ऑफ योर प्रैक्टिस it's your job to delegate the task, but when you delegate there comes a problem ki like how I can trust that, how can trust that person, how can I trust that person if I'm delegating a task. Sir, how do you trust, how do you develop that trust in delegating that thing, that task to that person?